Hi guys, welcome back to my channel. Today I wanted to do a quick video on my clinical experience at Western Governors University. So I'm going to quickly go over how they set their clinicals up and the places where they placed us for the clinical. I'm looking at my transcript now to try and jog my memory of the different places that we were placed, because my memory is not that good. So okay, so first of all, in our Caring Arts and Sciences Across the Lifespan course, which is basically like a Med-Surg 1 course, we were placed in a hospital. All of our clinical rotations were in Daytona Beach, Florida, and I live in North Florida. So for every rotation, I was required to commute. And whenever I would have my rotations, I would stay in a hotel or an Airbnb. Airbnb is a lot cheaper, and I actually, some of the people, since I was like a repeated customer, they would give me a discount. Like I said, we were placed in a hospital for like that Med-Surg 1 class, and the hospital was like a newer hospital in Daytona, so it was very nice in there. They had like a lot of brand new supplies and equipment that I wasn't used to seeing in other places where I had worked. So that was very exciting. With the clinicals, you have to work your preceptor's schedule. So you have no say in your schedule. A lot of times I got night shift, and I absolutely despise night shift. Like, it caused me to have to stay extra days and days. I wouldn't be able to drive back immediately after, even though some days I did. So I would work 7 p.m. to 7 a.m. and then immediately after my shift, I would drive 4 hours home and then try to pick up a couple hours at my regular full-time job. So y'all, I was struggling. Like, I was struggling, and I do not recommend that at all. My preceptor for this first clinical rotation, I believe I worked like 3 days. So I worked 3 days the first week, 3 days the second week. The clinical window is like 2 weeks long, and then they have like a third week, which is like a makeup week. So if for whatever reason your preceptor like called out, or you couldn't get your 6 days in those first 2 weeks, you would do it that third week. And all shifts are 12 hours. So you're working the entire shift with your preceptor. For my next course, which was the care of adults with complex illnesses, which is again like in a traditional program, is like a Med-Surg course. And I was placed in the same hospital on the same floor, which was the cardiac step-down unit. That floor, it was not bad. It got a little monotonous because it's like everyone is there for the same thing. They're going to surgery, they're coming back from surgery, all for heart-related issues. So they're having bypasses, going to the cath lab, things like that, and everyone is on the same medications. So it got a little repetitive being on that floor, especially since cardiology is one of my weaker subjects, and I just don't like it. So my next course, which was the psychiatric and mental health nursing, we were placed in an inpatient psychiatric facility. I think it was a state institution. I don't remember that part, but it was an inpatient psychiatric nursing facility. Some of my classmates were placed on the side where people were going for detox and things like that. I was placed on the side with the higher acuity level patients. These some of the patients there were from the state prison, and they were waiting to be transferred to the state psychiatric institution. So we were like a hold for them or whatever. But this place, I'm not gonna lie, it was kind of scary. Like, the people in there, they had like, one of the people, they had killed like a prison guard, and we were just like in there interacting with them with nothing in between us, just like interacting face to face. So it was a little scary. The facility was really run down. They did not have like a Pyxis for their medication. It was just like in a cabinet, and everything was paper charted. So whenever we administered meds, we had to like initial and sign, nurses' notes. Everything was on paper. So that was really different coming from the hospital where everything is electronic. They got this brand new nice Pyxis machine and all of that. Yeah, there was none of that at this facility. The next course was our community health and population course. Some of us were placed in hospice home health care, so we were placed with a home health care nurse. Some of us were placed in a adult day facility for adults with kind of like mental illnesses and things like that. So it wasn't they provided no medical care at this place I was placed at. It was more so like a place where they could come, like a safe place for them, where they can practice their social skills, interact with other people. Next, care of the developing family. We were placed in the hospital on the OB floor. That was very exciting. I got to attend 3 C-sections and 2 vaginal births, so that was like really cool. I didn't really do anything with the babies. There were some of us who were placed on they didn't have a nursery. They did have like a NICU, so some of us were placed like on the NICU part. But yeah, so we deal more so with the mothers and not really the babies. Nursing care of children, again, some people were placed back in the NICU for, this is our PEDS course. They were placed back in the NICU for that. I think I was given 2 days in the pediatric emergency room. And then all of us also did some time at a school for children of teen mothers. It was a really nice program that they had. They assisted the teen mothers with finding jobs, getting just gave them like a bunch of resources, and the school, I believe their children were able to go there free of charge for up to the age of 5, and they provided education. Their mothers attended the school too, so it's like they were able to get their high school diploma while their child was also getting their education. So it was really critical care. I was placed back in the emergency room. That was my last rotation prior to our practicum, and not much to say for critical nursing, as my preceptor let me do literally nothing. I don't understand what the problem was. She had another student before me in my same class, and she was telling me all the things she got to do. Like she got to do a lot with her. But me, even when I asked to do things, she'll be like, well, let me do it this first time so you can see me, and then the next time I'll let you do it. Next time came, still didn't let me do it. So, and then our practicum, we were supposed to do 180 hours, but guess what, guys? We didn't get to do it. It was canceled because of the pandemic that's currently going on. So instead, we got to do some sims. And I might do another video showing you guys the sims that we had to do. It was ridiculous. Like, we did some of these same types of sims earlier in the program as like lab practice and things like that. But having to do this to actually count towards our hours, I feel like I didn't learn that much. I'm not even gonna lie to you. So those sims were ridiculous, but that's basically it regarding the clinical rotations in Daytona. So yeah. What are you doing?